Ever had the sudden feeling of fatigue, chills, and a sore throat? You might be at the onset of the flu. The flu, or influenza, is a common but serious viral infection, one that can leave you bedridden if not treated properly. The initial symptoms can come on quite suddenly and be quite varied. You might experience a fever that seems to come out of nowhere. Your muscles might ache, and you may find yourself alternating between chills and sweats. You may also develop a headache, dry cough, and feel generally fatigued or weak. Nasal congestion is common as well, along with the uncomfortable sore throat. These symptoms typically begin 1 to 4 days after the flu virus has entered your body. It's your body's way of telling you that something is off, that it's fighting off an invader. So you're not feeling well and suspect it's the flu. What's next? Your symptoms have intensified and you're feeling pretty miserable. Welcome to the peak of the flu. During this stage, which typically unfolds within the first 2 to 3 days of the onset, the flu really shows its teeth. This is the time when your symptoms are at their most severe. You might be experiencing high fever, chills, body aches, a persistent cough, and an overwhelming feeling of fatigue. It's not a pleasant experience, to put it mildly. This is also the period when you're most contagious. The flu virus is having a field day, multiplying inside your body and making you a walking petri dish. So it's crucial to stay home, rest, and avoid contact with others as much as possible to prevent the spread of the virus. The peak of the flu is tough, but hang in there. There's a light at the end of the tunnel. Now you've made it past the worst. Now you're on the road to recovery. This is the phase where your body has started to reclaim its territory from the flu virus. It's the recovery stage, which usually kicks in around the 4th day and may stretch up to a week. During this period, you'll notice that the severe symptoms of the flu started to recede. The high fever, the chills, the body aches, they lose their grip on your body. But don't be fooled into thinking you're completely out of the woods yet. You may still experience a dry cough, a symptom that often lingers a bit longer. Your body is still healing, still clearing out the remnants of the flu. So a mild fatigue might also linger. You might also find that your appetite isn't quite what it used to be. That's normal. Your body has been through a lot and is focusing its energy on recovering rather than digestion. Keep yourself hydrated and nourished with light, easy to digest food to help your body regain its strength. And remember, recovery isn't a race. Listen to your body, rest when you need to. Stay patient and positive. You might not feel exactly like yourself for a little while, and that's okay. This stage is all about healing and regaining your strength. You're not quite back to normal, but every day brings improvement. Soon, you'll be back to your old self. You've weathered the storm and come out on the other side. But what's this aftermath all about? Just like a storm, the flu leaves a trail in its wake. Even when the worst is over, your body might take a few more days to completely shake off all symptoms. You see, the flu is a bit like an uninvited house guest. It barges in, makes a mess, and even when it leaves, you're left with a bit of a cleanup job. This can manifest as lingering fatigue, a residual cough, or general feeling of being under the weather. It's crucial to remember that this is entirely normal and a part of the recovery process. During this period, your body is mending the damage caused by the flu virus. It's rebuilding its defenses, repairing tissues, and regaining strength. The focus should be on continued rest and hydration. Consider this phase as the final stretch of your flu journey. It's also important to remember that flu is not a one-size-fits-all illness. While most people will see symptoms recede within a week to 10 days, some might need a bit longer. So there you have it, from onset to aftermath. The flu typically lasts anywhere from 1 to 2 weeks. Remember, every flu journey is different, and if symptoms worsen or persist, always consult a medical professional.